A 57-year-old female patient comes into her office saying, I don't have enough teeth to even chew a salad. I look at her teeth, and her teeth are great. She doesn't have enough of them. And even the great teeth are teeth that are compromised because of her bite. And yes, she decides to extract the teeth that I think are okay. Why did she decide it? Why did I agree to it? What is she going to do instead? We'll talk about that on Practical Treatment Planning. So she walks in, and you take a look at her teeth, and take a look. She has two bad teeth right here on the lower left side. You see this tooth in this dark area, that means there's a lot of decay. And the tooth next to it has a root canal, and the root canal is failing. You see this dark area at the end of the root. You and I, when we're together, we talk about bite a lot. Let's look at the bite here and take a look at the photograph, and you can get some impression as to what's going on here. You see the upper teeth are a little bit short. You also see there's spaces between the front teeth. But now I want to show you what you may not be able to see on the photographs. You can see it a little bit, but you'll be able to see it better in the CT scan. Remember, we take CT scans in occlusion. That means the patient is biting down when we take the CT scan. That's not ordinarily done, but in my opinion, it's essential. And I want you to take a look at the position of these teeth. And we'll look at them one by one. First of all, let's take a look at the front teeth. You see how deep that vertical overlap is. You see the lower front teeth and see how deeply they bite down. But now I want you to take a look back here. Okay? So let's take a look here at the right side first. And notice how close this lower tooth comes to the upper ridge. And we'll look at the same thing on the other side. This is a bite that's overclosed. In other words, with her bite the way it is, the way when she bites down all the way, there's not enough room for posterior teeth. Oh yeah, we could struggle to do it, but we would really not come up with something that's successful. She has great bone. Take a look at how wide this bone is. But now, how do you create enough room for teeth? Now, we talked about aesthetics a little bit, and she has spaces between the teeth. She said she's not worried about the spaces much. She'd like to have a nice smile. If we were to close the spaces, the teeth would look too wide, look like chiclets, and so we wouldn't be doing her a big favor. But the more important thing is, how do we get rid of this deep overbite? Because unless we get rid of the deep overbite, we can't give her any posterior teeth that are going to be of any consequences. She'd waste an awful lot of time and an awful lot of money doing so. The key to this is being able to open the bite. Okay, now we'd ask the orthodontist to move the teeth, but generally the orthodontist can do well going from side to side, but may not be able to take care of the overbite. We'd actually ask the orthodontist if he or she can do that. But if he or she can't, then the way you take care of an overbite is with crowns. You put crowns on the upper teeth that are thick on the tongue side, so the patient closes down on the crowns but can't close down as far as she was able to do originally. That allows enough room in the back to allow us to put in dental implants or partial dentures or whatever it is that she chooses to do. Complex treatment plan involves a lot of planning, but can be done and can be done beautifully. Now, what's the next part of this? The next part of this is two. Number one, she doesn't have enough time to do all of the work that would be necessary to do lingual platforms and do all the preparation work. She's not going to be here very long. But more importantly, what we're doing in order to be able to provide the lingual platforms and put the crowns in the teeth and do the orthodontic treatment and all the things that I think are necessary is actually going to be too expensive for her. And so while I hate to do it, because take a look at how good the bone support is on these teeth, the final decision that she's making, and I'm going along with it. And by the way, dental colleagues, write in the comments section, because you're going to argue with me. You're going to say I did the wrong thing. And I understand that. Write your considerations, because all of us will learn together. You're understanding my rationale, And her rationale, she wants to have something she can smile and chew with, primarily chew with. And she's saying it's too expensive to do it the other way, particularly when she finds out that it'll be less expensive to do it with dental implants. So, what's the final treatment plan going to be? Well, first of all, we've got to extract these bad teeth on the lower left side. One is giving her a toothache. The other one has a deep jawbone infection. So we've got to get rid of that right away. And if we did nothing else, that's all we would do. But if she wants more teeth to chew on, and she does, then we're going to extract all of the upper teeth. We're going to utilize that big, beautiful bone to place implants where they need to be placed. And once we have the implants in place, we can make the prosthesis as thick as we need to in order to be able to prevent that overclosure and now have room for teeth in the back that are supported by implants. Okay? Now, what's the final consideration here? If we keep her natural teeth the way we are and the way they are right now, and we will, those teeth are already worn. You see how they're worn? And they're going to be biting against an upper prosthesis, and the upper prosthesis is going to be harder than the lower teeth. So in a case like this, we have to make sure that she's willing to wear a night guard, something that's made out of plastic, so that that night guard is fitting over her lower teeth or over the upper prosthesis so that she doesn't grind her teeth away. And if she does that, she's going to have a good, long-lasting restoration. Finally, what's the other consideration here? And that is failure of dental implants. Remember, we've talked about the fact that we'd prefer to save teeth. I'd prefer to save teeth. I'd prefer to do the original treatment plan, do the orthodontics, do the crowns that are necessary, and then supplement with implants in the back. But she says no. If we look at the part about dental implant failure is more likely to occur in somebody who has periodontal disease than someone who doesn't. She has no periodontal disease, and therefore the opportunity for a long-lasting restoration is in her favor. Can't promise, but in my experience and experience in the literature, somebody like this who has no periodontal disease has a very good chance for long-term dental implant maintenance. Doesn't mean that she doesn't need professional cleanings, and doesn't mean that she needs to come to a dentist on a regular basis once we complete this reconstruction. But with that, and good oral hygiene, the opportunity of maintaining these teeth and maintaining these dental implants for many, many years is very good. You have some comments? Please write them in the comments section. And I look forward to seeing you again soon. As far as she was able to do originally.